Hello, my name is Matt Lordo, and today I'm going to tell you a little bit about my research. And to start, I would like to introduce you to this fictional patient named Chris. And for the past several weeks, Chris has not been feeling so well. He's been describing symptoms such as these, including unexplained fever, headaches, abdominal pain, bone and joint pain, and some more concerning symptoms like unintentional weight loss. And this has been going on for a few weeks now, and Chris is thinking that this might not be the flu. So he decides to call his doctor and to go in for an appointment. And as part of his workup at his doctor's office, they decide to draw some blood and look at it under a microscope. And as seen here, this is what they would expect to see in a normal, healthy individual when they look at their blood under the microscope. And you can see that there are these pink cells, which we call red blood cells, as well as white blood cells, which are a little bit larger and have a purple center like you can see in the center of the image. However, when they look at Chris's blood under the microscope, they see something like this. And you can see that not only are there decreased red blood cells, those pink cells, there's also an increase in these abnormal looking white blood cells that are larger and more irregular than what a normal white blood cell should look like. And this is consistent with a diagnosis of leukemia, or a specific type of leukemia we call AML, or acute myeloid leukemia. And in order to confirm a diagnosis of leukemia, a bone marrow biopsy must be done. So Chris's doctors order a bone marrow biopsy, and Chris has this done in the hospital. And as part of a bone marrow biopsy, this metal syringe is injected into the hip bone, and a piece of marrow is removed and looked at under the microscope. So Chris has this procedure done and is confirmed as having a diagnosis of AML. And from the moment that Chris is diagnosed as having AML, he does not leave the hospital for several weeks or months. And during this time in the hospital, Chris receives aggressive chemotherapy in order to kill the leukemic cells and hopefully put Chris into remission so that he can go on to receive a bone marrow transplant. And this procedure of receiving chemotherapy followed by potential bone marrow transplants for some patients has been the mainstay of treatment in AML for decades. And so looking at over the past 50 years, you can see that even though there have been advancements in therapy over the past 50 years, the overall death rate in AML has remained relatively stagnant. And this underscores the need to better understand AML biology so that we can better design therapies that actually work and manage to reduce the death rate in a meaningful way. And as you can see, the 5-year survival rate in AML is only 29%, so only about a third of patients are alive at 5 years. And clearly we need to do much better. And if you want to think back 50 years, TV shows like MASH were first airing on TV, and movies like The Aristocats were first coming out in theaters. So that's about how long it's been since we've seen meaningful changes in AML. And of course, there have been advancements in cancer therapy in that time. However, we have still not seen a meaningful change in survival outcomes for patients with AML. So part of my project is trying to better understand how AML works and functions so that we can design therapies to better treat it. And that's what I want to discuss next, the next frontier in cancer therapy. Chemotherapy has been the mainstay of cancer treatment for decades. However, there is a new wave of research that suggests that harnessing the untapped potential of the immune system is a better way to treat cancer, and also is a more targeted way that has less side effects for patients. And so that's what my project does. I am trying to understand how the immune system, the normal immune system, is affected in AML and how we can better harness that to treat AML patients. And so we have this cell type in our body called an NK, or natural killer cell. And these cells' sole job is to target and kill cancer cells, and they're normally very good at it. However, in patients with AML and other types of cancer, they often have decreased maturation or decreased maturity of their NK cells. So their NK cells are not growing up to be the anti-cancer cell type that they're destined to be. They're instead being stuck sort of in childhood, if you want to think of it that way. And patients who have hypomature NK cells, as you can see on this red line here, have worse overall survival than patients who do not. And so part of my research project is trying to understand how this NK maturation defect develops in AML and how we can better target it to restore mature functional NK cells that are anti-cancer. And so to think of it in another way, NK cells are kind of like your offensive line. Their sole job is to target and tackle the AML cells to prevent them from progressing. And as part of my project, I'm also studying the broader immune system. And NK cells belong to a broader class of immune cells called innate lymphoid cells. And if they have a cousin cell type termed an ILC1, which instead of being an offensive lineman, is more of a bench warmer cell type. And although we see that NK cells are functionally and developmentally inhibited in AML, we don't know if these other cell types, such as ILC1s, are affected. So part of my project also was to understand how other innate lymphoid cell types are affected in AML. And to begin to look at this, I turned to an AML model that we use in the lab to study AML biology. And what I found in the bone marrow of this model is that, as I expected, there was a reduced number of NK cells in the bone marrow of leukemic cells. However, there was an increase in the number of ILC1s. And this was unexpected. We hadn't known previously that ILC1s were increased in AML. And since I saw this observation in our model, I next wanted to see if this actually happens in AML patients. And so I looked in AML patient samples and found that relative to normal healthy individuals, AML patients also have increased ILC1s and decreased NK cells. As you can see here, TBET is an ILC1 marker and eomase is an NK cell marker. And you can see that AML patients have increases in ILC1s and decreases in NK cells. So we not only found this in our model, we also see this in patients. And we next wanted to dig a little bit deeper and understand how this occurs mechanistically to increase ILC1s and decrease NK cells. And I guess to start with the basics, NK cells develop from ILC precursors, or ILCPs. So this is a cell type that is a little bit more immature, but can develop into a mature NK cell. And what we found was that AML cells are able to secrete soluble factors into their environment called AHR agonists. And AHR is a transcription factor that is important in regulating immune cell development and function, and it's expressed in these ILC precursors. When AHR agonists activate AHR in ILC precursors, it shuts down their ability to become an NK cell. And as I mentioned earlier, there's a related cell type to an NK cell called an ILC1 that is also able to develop from these ILC precursors. And whereas AHR inhibits NK cell development, I actually found that it increases development of ILC1s. And so AML appears to be able to manipulate this AHR pathway to shut down NK cell development and reroute these ILCPs to develop into ILC1s, which again are that bench warmer cell type that are not able to target and kill the cancer cells. And so to come back to our analogy, my project is hoping to design and test AHR inhibitors to block AML's ability to manipulate this pathway. And in doing so, we aim to decrease ILC1 development and restore or retrain these ILC precursors to develop into NK cells, which will restore the offensive line and keep the AML from progressing. And in creating this new line of therapy, we hope to provide better treatment options for patients like Chris so that they no longer have to receive aggressive chemotherapy and can instead receive this more targeted therapy to bolster the immune system to hopefully better target and kill these cancer cells and improve patient survival. Thank you.